Hi, this is Joe Moore. Sorry for the delay this morning. I'm glad you're here today. Today we're going to talk about the basics of Medicare to help you get started when it's your turn aging into Medicare, turning 65 or qualifying. Again, I am Joe Moore. I live here in Colorado Springs and I specialize in Medicare. This is all I've been doing pretty much since 2010, and I look forward to being able to help you. So let's get started. So first of all, what is Medicare? Medicare is the federal insurance program that's designed for people 65 and older, or those who may have a qualifying disability and qualify at an earlier age. CMS, or the government agency that regulates Medicare, or Centers for Medicare and Medicaid Services, is the program or Medicare that makes all the rules for the Medicare program. Okay? So let's talk about what Medicare covers. Medicare is going to cover your hospitalization. As you can see, there is a deductible that comes along with that. Medicare will also cover your doctor and outpatient surgery, as well as your medical benefits. Medicare also covers Medicare Advantage plans. Those are administered through private insurance companies. We'll talk more about Medicare Advantage plans as we go through the process here. And of course, Medicare is going to cover your Part D or your prescription drug coverage. So when enrolling in Medicare, you have different time frames where you can do so. First of which is your initial enrollment period. So that starts 3 months before your 65th birthday. You have the month of your 61st birthday and 3 months after. So you have a full 7 months to decide what you'd like to do with your Medicare benefits. There's also general enrollment periods. General enrollment period, if you were to miss your initial enrollment period, would start January 1st to March 31st. That's where you can enroll in your Part B if necessary, and those benefits would start July 1st of that following year or same year. And there's also some special enrollment periods. This would be in the event that you were to decide to work past 65, maybe you're 66 or 67, and you decide mid-year that you'd like to retire and take advantage of your Medicare benefits. You can do that due to a qualifying ability to do that during a special enrollment period. Okay? So what is Medicare Part A? Medicare Part A is your hospital coverage. It also covers hospice if that's ever necessary. It will also cover some home health care benefits as well if you ever need those. And Part A has a deductible. This deductible generally changes every year. Right now it's $1,408, so I would expect that to most likely be higher in 2021, even though I do not know that. That just seems to be how Part A works. That deductible is going to cover you for the first 60 days that you're in the hospital. So what is your Medicare Part A premium? Typically, you would have no Part A premium, and that's due to you working a certain amount of years or quarters. You work 10 years or 40 quarters and pay into the system, that pretty much pays for Part A of your Medicare. And what is Medicare Part B? Again, Part B is your medical insurance, and that's going to cover your doctor, your outpatient surgeries. It's going to cover your durable medical equipment, walkers and wheelchairs and oxygen. Part B also covers palliative care, which is, again, something prior to hospice, usually that might be necessary. And Part B also covers Part B medications. Part B medications are chemotherapy drugs, osteoporosis, oral cancer injection medications, things your doctor has to give you in a controlled manner, kind of in your doctor's office. So Part B does have a lot of coverages for you listed there. Also covers some preventative services, which is a great thing to take advantage of. All right, so what are the costs of Part B? So Part B has costs depending on your income. So in the event that you qualify for, let's say, a limited income or an extra help type of situation or Medicaid, you may not have a Part B premium, or the Part B premium you do have, that you either enroll in your Part B or you have other coverage that's just as good as Medicare, so you don't have a penalty for that Part B later. So just to recap, the initial original Medicare benefits. So you have your A, hospital, B, your doctor and outpatient. Of course, you can pick a Medicare Advantage plan, and also you're going to need some sort of prescription drug benefit, whether you take medication or not, and we'll talk more about that as well. And with that, those A and B cover 80% of your medical benefits. So you have to decide, how do I cover the other 20% and also take care of my prescription drugs if necessary? All right, so your options are option 1 or option 2. And regardless of which option you pick, option 1 or option 2, you must be enrolled in Part A and Part B of your Medicare. Okay? Option 1 is considered original Medicare. That's where you would keep your Part A and B original Medicare card. You would get a secondary insurance called a supplement or a Medigap policy to try to pick up the 20% Medicare leaves for you. And then you'd also have a prescription drug benefit you would purchase separately as well. Medicare Advantage is option 2. Again, you cannot have both of these, so you must decide which way you want to go. Original option 1 or Medicare Advantage option 2. And Medicare Advantage, again, we'll get more details about those, but those are administered through private insurance companies that are approved by Medicare for you. So let's spend a little bit more time talking about Medicare Advantage. Here we go. So what is Medicare Advantage? Medicare Advantage is also, you might hear the term Part C describing Medicare Advantage. That's the same thing. All right, so again, Medicare Advantage plans are plans that Medicare has approved certain private insurance companies to administer the plan of Medicare for them. The best thing about those plans is that they must cover the same amount as original Medicare, meaning 80% of your medical benefits, A and B, or more, nothing less. So you're always going to have all your medical benefits. You're never giving anything up, whether you go option 1 or option 2. And let's see, plans may offer additional benefits. So Medicare Advantage plans are great due to the fact that they do offer dental and vision and hearing, and some have acupuncture and gym memberships, things that original Medicare typically doesn't cover, even a physical every year that Medicare Advantage plans will cover for you. All right, so we'll continue there. Monthly premiums for Advantage plans. So typically, Advantage plans in Colorado Springs, most of them are zero premium, so there's no additional cost. So your Part B is going to cost $144.60, let's say, and then you just enroll in your Advantage plan, and there's typically no cost for those. Some do have a premium if you choose to go that route, but a lot of them offer a zero monthly premium, which is, again, spectacular. When you have a zero monthly premium in an Advantage plan, you are going to make co-payments. So when you go to the doctor, there will be an assigned cost per visit, specialist visits, doctors and hospitals and podiatry and anything like that. They will have a fixed cost, so you'll know exactly what it's going to be before you actually go in there. And there are so many different plans, and as a broker, I work with most of the big companies here in the Springs. They vary very much, so if you want more details about which ones do what, how they work with their networks, and what benefits do they offer, you can definitely give me a call with my information here. Or you can email me, however you choose to contact me. Now with Medicare Advantage, there's also enrollment periods. So we talked about the original Medicare enrollment periods, and some of the Advantage plans fall right under the same lines here. So we'll talk about those. So again, your Medicare Advantage enrollment period initially is going to run with the same as your turning 65, welcome to Medicare enrollment period. So you have 3 months before your birthday, the month of, or 3 months after to enroll in the plan. After that, there's what's called open enrollment, and that's generally my busiest time of the year. I stay busy all year, but generally during open enrollment, it's pretty crazy. And that's where anybody who has a Medicare Advantage plan or a standalone prescription drug benefit can change their plan. They can add a plan, drop a plan, switch a plan. They can do that between October 15th and December 7th every year. And there's also special enrollment periods, which keep me busy this time of the year, being that it's June. Outside of the folks that are turning 65 every day, there's also folks who move into the area. That would be a special enrollment period. Someone that moves from one county to another qualifies for a special enrollment period. Those who qualify for limited income, and you picked a HMO Advantage plan and you thought it was a PPO, during January 1 to March 31st, you can go from a HMO to a PPO, from a PPO to an HMO. If you did realize the plan you enrolled in did not include medication coverage, or Part D, You go in February, you go to the pharmacy, you can't get a prescription, get a hold of me, and you could also change your plan to add prescription drug coverage. So that's a really good benefit in case you were to make a mistake or had an error during your enrollment process during open enrollment. All right, so now we'll talk about Medicare Part D. And again, Part D is prescription drug coverage. Prescription drug coverage is going to vary depending on the plan you pick, what medications you take, those kind of things. To me, the Part D is the most expensive part of any plan because you typically take your medications every single month. So you're going to use your medications more than you're going to see your doctor. So you really want to try to use, if you can, generic medications or little to none if possible as well. So Medicare Part D is considered optional. However, if you do not enroll in a Part D when you're eligible, Medicare will penalize you a 1% penalty every month that you did not have a prescription drug benefit. And again, that penalty does not go away. So you have a Part B penalty at 10% a year, and you have a Part D penalty at 1% a year. So you want to make sure you have some other credible coverages. Credible coverages would fall in things like if you have VA benefits, that's considered credible. TRICARE for Life is considered credible. Some Native American benefits. And when I say credible, it just means just as good as Medicare or better. And Medicare decides that. So we talked about the CMS regulatory governing body of this whole thing. They make that rule. So they have to say what's considered credible. So you want to make sure you do something with your medication. All right, so again, Part D is your medical or your prescription drug coverage. We talked about this here that your prices may vary based on your drug usage, what you're taking, etc. Drug plan you choose. And the drug plans have very varying costs, anywhere from $15 to $200 a month, depending on what you need. The one thing that's consistent with prescription drug coverage is the donut hole or the coverage gap. It applies to all plans across the board, whether you're paying $0 and it's included in your Advantage plan, or you're paying $200 a month on a standalone prescription drug benefit. It's going to be the same for everyone when it comes to the donut hole or the coverage gap. Unless you have extra help. Or if you qualify for TRICARE, you may not have to worry about that benefit either, or VA. But generally, it's a rule for everybody. Okay, so give me a call again if you have questions about that. Not only can I tell you if you qualify for extra help, I can help you apply for it very simply. And extra help is just a sliding scale based on your income to see if you qualify for the state to assist you in your prescription drug plan cost. All right, so we talked a little bit about the donut hole or the coverage gap. This is confusing to most folks, so I'll try to make it really simple. As it says, Medicare made easy. That's what I try to do. The donut hole. So again, these numbers tend to change yearly. In 2020, you see that $4,020. What happens is each individual who has a prescription drug benefit is going to have $4,020 set aside for them, and that money goes toward the cost of your medication. And the key word is goes toward the cost of the medication. So every time you pick up a prescription, you may have a copayment of $2 or $4 or $10 or $45 or $100 depending on the medication. The true cost of that medication comes off your 40/20. So if you go to Walgreens, they say, let me have $2 for your copay, but the true drug itself costs $20. Now you're going to have $4,000 left, so on and so forth, okay? If you ever use that $4,020 up in the same calendar year, it does reset. If you ever use that up in one calendar year, then you fall into what they call the donut hole or coverage gap. To me, it just means you fall to the next stage. Instead of you paying a flat $5, $10, $47, $100 for your copays, you start paying 25% toward the cost of your medication. So that can get very expensive. If you're taking drugs that cost $400 a pop, you're getting pricier. So you want to, again, just be mindful of what you're taking. That's really the only way around that. If you ever spend $6,350 out of your actual pocket after you use up your $4,020, then you would be in catastrophic coverage. And at that point, the plan you're on pretty much pays for most of everything, okay? All right, so we talked about Medicare Advantage, which is option 2. Remember, Advantage plans are typically HMO or PPO now. There are some other options, but typically HMO and PPO. HMO meaning Health Maintenance Organization, where you must get a referral. Typically, some don't have referrals, but typically you might need a referral to go see from a primary to a specialist or to a hospital. And then you have a PPO, which you may not need any, well, you don't need any referrals, and you can go anywhere that Medicare is accepted as well. You might have a little bit higher cost on the PPO if you go out of the network, or you may have, of course, generally lower cost if you stay in the network. So go back to option 1, which is your supplement. We'll talk about that here. A supplement is just a secondary insurance that you pay for monthly that's going to cover what Medicare again leaves for you. Remember, Medicare covers 80% of your medical. Your secondary or your supplement is going to pick up that 20% Medicare leaves for you. All right. There is usually a deductible, again, for Part A and Part B. Your supplement may most likely pick up your Part A. However, it may not pick up Part B, and we'll talk about that here shortly as well. So premium costs do vary when it comes to supplements. A lot of them depending on the zip code that you live in. Male or female, do you smoke, non-tobacco users, those kind of things. Generally, when you're turning 65, when you are turning 65, you can be turned down for your Medicare benefits. So that's a great time to take a supplement because you cannot be denied to have that coverage. Let's go to the next one here. Okay, so just to touch base on the supplement side of things again, if anyone's familiar with Plan F or Plan C, the rumor was that Part F was going away. And all that really happened was if your 65th birthday was prior to January 1st of this year, 2020, you can still get Plan F. So if you delayed your Part B and your birthday was 5 years ago, you can still get Plan F currently. It's just if your birthday was January 1 of this year or going forward, you can no longer get Plan F, okay? And Medicare just put that in to kind of make people think a little bit, but in essence, if you have an F, it's going to pay both deductibles, Part A and your Part B deductible. Your Plan G or an N or anything like that we would talk about are not going to cover your Part B deductible, so you're responsible for that $198. That's the biggest difference between an F and a G and C aside from your premium benefits. Again, we can talk more about those specifically if you need that. And that is the conclusion of kind of what we were talking about there. Those are your Medicare basics. Again, I might have missed a couple things. I hope that I made that pretty simple. This is my contact information, so you can give me a call, you can email me. You can also go to my website, and there's some videos there that you can look at. So again, thank you for tuning in today. And if there's any questions, I'd be happy to try to answer those for you as well.